we are really excited today just to kind of help talk about, things like skin cancer screening prevention, things to look out for, and some overall skincare tips that hopefully everyone can learn something a little bit today that they can apply to their kind of daily life. And we'll try to kind of keep it short and sweet. That way we can have room for questions at the end. And so I'll have.
You guys hear me? Okay. I'm Jessica. I'm one of Dr. Wang's medical assistants. I've worked with her for about a year now. I graduated UCLA last year. I'm a pre-medical student trying to head off to med school. And then here we have.
Hey everyone, my name is Logan Chin. I'm also one of Dr. Wang's medical assistants alongside Jessica here. I'm currently a senior here at UCLA, not here, but at UCLA. So we'll be graduating this upcoming June, a little bit bittersweet. I'm also a pre-medical student, and I anticipate applying to medical school in about 2 cycles. So about 2 years that I'll be spending working at SoCal Skin and Surgery.
So here we just have an overview of what we're going to chat about today. I know Dr. Wang kind of covered a little bit about it, but we'll introduce our clinic, talk about some signs of concerning moles and things to look out for melanoma, ways we can protect ourselves from the sun, some eczema and sensitive skin tips, and then our do's and don'ts of dermatology and wound care, and then some of Dr. Wang's skincare recommendations. So I know Dr. Wang kind of went over this a little bit, but we are SoCal Skin and Surgery. We treat the Los Angeles community, specifically Marina Del Rey area, and we deal with medical, surgical, and cosmetic dermatology. So on the left here is Dr. Wang, and then on the right is Dr. Michelle V, who is our Mohs surgeon, which is a particular type of surgery for removing skin cancers. Okay, so for melanoma, there is a little tip. It's the A, B, C, D, E's of melanoma, and it's things to look out for when we look at our moles. So the first one is going to be asymmetry. It's when one half of the mole does not look like the other half. Okay. And then B is for borders. So this is when we look at the edges and identify any unevenness, blurriness, and irregularities or areas that are undefined in the borders. C is going to be for color. On the left here, you have a benign mole. It's uniform in color. Whereas here we have more of a harmful mole that has color variation. Sometimes that can be reds, even blues or blacks. D is for diameter. So now we're looking at the size of the lesion. Typically a good parameter is to think about the back of an eraser tip on a pencil, which is about 6 millimeters. So you want to make sure the moles are not larger than this. And we also want to check for the growth. So if you see growing more than 5 millimeters in a span of about 6 months, that would also be another concerning sign. And then E is the last one. This is going to be an evolution. So here we can see it starts pretty small and pretty uniform in color, and then gradually we're seeing changes in shape, size, and maybe new symptoms too. So crusting, bleeding. And then when we look for moles that are harmful, it's typically that ugly duckling mole, so the one that doesn't really look like your other ones. So as we conduct skin checks at home, and we want to keep the A, B, C, D, E's in mind, and this is also why it's important to go get your annual skin checks as well, so a doctor can see those hard-to-see places.
All right, a couple other types of skin cancer are on this slide. We have basal cell and squamous cell carcinoma, and here are some things to look out for. So for basal cell, it could look like a small, pearly, or translucent bump, as seen in this picture, or pink, flesh-colored, or a white lesion. And for squamous cell, it could be a firm raised nodule or a plaque. You can look for scaliness or crustiness, and in terms of color, it could be pink or red, even to yellows and browns. But a couple of things to look out for are going to be non-healing wounds. So if you have a scab or another scrape that is not healing over the span of several weeks or months, that's something to definitely bring up to your doctor. Something that's fast growing, like the melanoma that Jessica just went over. I'm definitely going to want to look out for that, as well as bleeding and pink lesions. And in terms of where these are going to appear on your body, they often occur in areas of high sun exposure. So out here in sunny Catalina, definitely love to soak in the sun. But on places like the nose, arms, hands, or neck that get high sun exposure, these are the areas that you're going to want to pay special attention to.
Those ones are super important because normally we think of harmful moles as the brown moles that we have, but even those pink or reddish lesions can also be harmful.
Great. And speaking of high sun exposure, what that means for skin cancer, who can name some ways that we can protect ourselves from the sun?
Out to you guys, yeah.
Great. Sunscreen, SPF.
You're spoiling. Hats, that's a great one. Anyone else?
I didn't hear what she said. What did she say?
Hats.
Oh, hats.
Yeah, hats.
Yes, hats are very important. And let's see.
What did we come up with? So we have sunscreen. I heard someone say that. We recommend SPF 30 as a daily minimum. But if we know we're outdoors, like here in Catalina, I know a lot of our days are spent out in the sun, we recommend SPF 50. And we have to remember that sunscreen does break down in sweat and heat and water, so reapplication is very important. We also have shade, so making sure we can find cover, and then especially if you're out in the hours of 10 a.m. to 4 p.m., because the sun is the strongest then. But hats is a great way to cover up. We also like wide brim hats because those can also protect our neck as well as our scalp and our face. And then clothing. I know there are UV protected clothing that are branded that way, but as long as we have long sleeves, long pants, those are also great ways to protect ourselves.
Great. So now we're going to go over eczema and sensitive skin. So as enticing as a hot shower sounds at the end of a potentially sweaty day, you're going to want to avoid hot or scalding water if you have sensitive skin like I do, or have eczema. We like to recommend to limit showers to about 10 minutes using lukewarm water. That's going to be best for the skin since hot water actually dries it out, weakening your skin. In terms of soaps, we recommend to use them sparingly or avoid soaps, especially if you're taking potentially many showers a day or every day. Try limiting to just the necessary areas when you are practicing hygiene. We recommend what Dr. Wang likes to call boring types of lotions and creams and soaps. So avoid products with fragrances like colognes and perfumes. These can be potentially irritating. And speaking of lotions and moisturizers, the best time to do that is actually right when you get out of the shower, while the skin is still damp. So maybe there's a couple of drops of water on your skin. I like to put on my lotion, and that helps lock that in and protect your skin barrier. And then the last tip that we have for eczema and sensitive skin is to avoid overwashing hands with soaps unless they're heavily soiled. So definitely when you're cooking and cleaning, that's going to be important. But if it's not necessary to use soap, just water is fine in most circumstances.
And we do know as we get older, our skin thins and actually retains less water. So it's going to be more important to make sure we're keeping moisturized. Could be multiple times a day after you hand wash, throw on some moisturizer. And lotion or creams are actually thicker than lotions. So if you're dealing with a lot of dry skin, grab the tubs of cream. And then we have some skin recommendations, some cream recommendations.
Here are some other recommendations. So fragrance-free detergents that you can use for your laundry, and then Dove unscented soap that's super gentle on the skin.
Okay, and then here we have some do's and don'ts of wound care. So on the left, we have our do's. We like to clean wounds with gentle soap and water. Again, those will be unscented products. Vanicream, CeraVe, Cetaphil, those are great brands. Vaseline is going to be good to prevent dryness and that scabbing. And we keep cuts covered with Band-Aids, which you can change once a day. So a once-a-day bandage change, Vaseline, and then the Band-Aid is perfect. Now, don'ts will be avoiding hydrogen peroxide or Neosporin, which are those harsher products. And then I know how tempting it is, but picking, popping, scratching at scabs can cause more irritation and potential infections, so we want to avoid that. And then most important don't is to not ignore sores that are there for a while or have this come and go effect that are persistent and non-healing.
All right, and here's some skincare recommendations. So we like to break it up into a morning regimen and a night regimen. Both in the morning and nighttime, we recommend using a gentle cleanser. So something unscented, once again, like Vanicream, CeraVe, or Cetaphil are going to be brands that we recommend. It's really important to put on that sunscreen, like we mentioned earlier in the presentation. So for SPF, one that you can find at the local drugstore over the counter is La Roche-Posay or CeraVe once again, and a little bit more expensive, but these have different tinting aspects to it too. Elta MD is another brand that we recommend. And then at night, definitely want to make sure that you're locking in that moisture on your skin using a gentle moisturizer. And once again, we really like La Roche-Posay and then these other two brands as well. A couple of bonuses. In the mornings, you can add vitamin C into your routine in terms of brightness, and then in the evening time, you can add retinol or retinoid to prevent acne.
All right, that is all from us. Any questions from you guys?
Yeah, I have a question. I recently saw a patient that has had melanoma for many years, and they told him of a supplement that he'd been taking every day. And at the time, I looked it up, and it is on the internet as a good supplement to take. What is the name of the supplement?
So there are some supplements that can help with, in general, what we call
Yes.
chemo prevention.
Yes.
Niacinamide is one.
What was the name?
Niacinamide. I don't know if that was
It
one.
was a different one.
Another one we sometimes use just to prevent more oxidative damage from the sun is something called monosodium. I don't know if that was the one. But those are usually the ones
The two.
yeah.
Yeah, he had said it was he had to get it through. I was just fascinated because just so many people on the island that would benefit from that, and I, as a provider, didn't even know that such a thing existed. So I would love to maybe I'm going to get with him again and maybe share that with you, and then I would like to be able to start telling my patients to start taking, especially when they have a history of melanoma, which many of them do. And I never even thought that there was something that could help them on a daily basis.
Yes.
I'm just wondering what services can you do here as far as, people do surgeries? What can you do here?
Yeah, so here we would do the biopsies. So if Dr. Wang saw a suspicious lesion, we can take care of the biopsy here. Typically, if it did come back as cancerous, that would require traveling to the mainland, either seeing a surgeon out there. Dr. Wang does skin cancer excisions. And then our other physician, Dr. V, does specific Mohs procedures. Here we can also do some freezing of precancerous spots or like warts or age spots. And then, unfortunately, the cosmetics will be over in Los Angeles, but feel free to come visit us in Marina del Rey. We take care of that stuff as well.
Any other questions?
Yeah, so we like Vaseline or Aquaphor. Aquaphor is like just petroleum jelly, basically. There is an ingredient in Aquaphor that some people don't react well to, so Vaseline is kind of the most generic, gentle you can get, but if Aquaphor works for you, that's also great.
I have heard that there are some cosmetic treatments that can help prevent some skin cancers. Is that accurate, or?
I'll have you take that one.
So, no, that's a good question. Something that we do in the office is actually chemical peels. And there are kind of more aggressive chemical peels that actually can be covered by some insurance companies, Medicare being one of them. And what it does is you're essentially
screen or a little machine? Are you doing anything like that with nylon?
Unfortunately, those will also be, very nice. Yeah. Yeah. Can't come with us on the ferry.
So excited that you have now dermatology and you want to get to work. But a lot of patients ask like really specific questions and I have not been able to answer them. Like how detailed and what do you think I could get done here? So the freezing you will do with our the stuff that we have. You bring your own stuff.
In terms of sunscreen, is it any like less effective if it's tinted?
So tinted is actually great. It also contains a product that helps with blue light from our phone screens as well. So that's great to use tinted sunscreen.
Does sunscreen expire?
Yes.
So what's the shelf life?
Oh, it should be on the bottle. I'm not sure. I think, all the sunscreens that are available are pretty good with FDA approval and making sure it's getting what needs to be done, but expiration should be on in each individual bottle. All right. Well, if that's all the questions, then thanks for your time. And I hope you guys start wearing sunscreen every day. Yes. Hats, clothing. I know it's about to get really sunny out, so even today, SPF 50 on the face would be great. I know we're going to start getting back in the water. Sunscreen breaks down, so reapply. And thank you guys.
Thank you. Thank you.